I want to take this moment, first of all, to really thank the people of San Francisco, because we know that it is because of many people in this city, the fact that you have been wearing your mask, social distancing, washing your hands, and staying home in most cases, even though I know it has been challenging. Because you have done that, we have not seen San Francisco's numbers increase like some other cities that are experiencing significant challenge. But I also want to be clear that we are seeing an increase. Our numbers, along with numbers all over the country, are going up. And we are not out of the woods yet. I have said in the past, Dr. Colfax has said in the past, the COVID-19 virus, this COVID-19 is with us for at least anywhere between 12 to 18 months. And what we are trying to do is adapt to our new normal. And part of adapting to our new normal means that we not just want to keep ourselves safe, we want to keep the people around us safe. I can't express enough how important it is to wear your mask whenever possible, especially when you're around other people. It's not just about protecting you, it's about protecting them as well. And we, as you all know, are still having a number of challenges. And I want to talk a little bit today about our reopening efforts, because I know that that's really been at the top of everyone's mind, is what is happening. Last month, I made an announcement about a timeline, specifically when San Francisco was planning to reopen. And we were doing well in terms of our numbers. As we said, we will look at the data, we will look at what's happening in our city as it relates to hospitalizations and other information and make decisions. So we moved up our timeline. Once the state provided us with a variance, we were planning to allow businesses to reopen as early as June 29th. And then something changed. We saw a spike, one that we have not seen in a very long time. And as a result, we had to put a pause on the opening of those businesses. And I know that it was very detrimental, especially it's already been financially challenging for so many hair salons and nail salons and a number of other businesses that were planning to reopen. And I know that this was very challenging, but this was definitely a matter of public health. So it's hard to make that decision to put a pause on reopening. And the original date before we were granted the variance was scheduled to be on July 13th. So I want to be clear that as of today, we must announce that on July 13th, we will not be able to allow restaurants to operate indoors as we had planned, nor will we be able to allow bars to open outdoors on July 13th. And we continue to evaluate the information and to make the decision. If we see the numbers stabilize or decline in any way, we will reevaluate that information and begin the process of determining what businesses can open. But unfortunately, with what we are seeing, and Dr. Colfax will talk a little bit more about the indicators and where we are, we have no choice. We are living in COVID, and I think what I want to reiterate is the fact that we are all in this together. What you do or what you don't do impacts someone else, whether you know it or not. And that's why it's so important that we follow the guidelines of the city to wear our masks, to socially distance, to wash our hands, to do everything we can to stay apart from one another during this time, especially as we see the numbers increase. So I want to, at this time, introduce Dr. Grant Colfax, who will talk a little bit more about what's happening. And I also, as I said, Joaquin Torres is here because we know that, again, our small businesses in San Francisco who have already been struggling continue to struggle. We started a number of funds and a number of things to try and help support these businesses. I know it's not enough, but I want to be clear that, this is not a decision that we are approaching lightly. We know that in order to protect public health, we are creating other challenges for small businesses. We're creating other challenges because we know that over 153,000 San Franciscans have filed for unemployment. We don't make these decisions lightly. And this is why we want to reiterate how important it is for us to listen to the guidelines and to do our part. We need these numbers to go down. We need these numbers to go down. So we need not just people in San Francisco, but the folks who are also coming from other places to San Francisco, the people who are working in San Francisco, folks who work for our nonprofit agencies serving our homeless population are coming from cities all over the Bay Area, people who are working in our hospitals, our public safety officials. What impacts one impacts us all. So this is not just about San Francisco. This is about the entire Bay Area and our need to take this virus seriously and to all do our part to keep one another safe. And in San Francisco, as we see changes in the data, as soon as we are able to allow things to reopen, it will be at the top of our list. But we need to do so safely. So I thank you all so much for your cooperation. And at this time, I want to turn it over to Dr. Grant Colfax.
Well, thank you, Mayor. Good morning. I'm Dr. Grant Colfax, Director of Health for the City and County of San Francisco. I want to thank all San Franciscans for their sacrifices during this unprecedented time. The psychological, physical, and economic toll wrought by the pandemic are severe and continue to have major impacts across the city and region, particularly among communities already facing socioeconomic and health inequities. The virus has further exploited these fault lines, and so far, for the most part, we have managed to avoid the worst consequences of the virus and the pandemic. But that could change at any time. Today in San Francisco, we have 4,020 diagnosed cases of COVID-19, and unfortunately, 50 people have died of the disease. In the Bay Area region, there are over 30,000 cases and just over 600 deaths. In the state, nearly 250,000 cases and nearly 6,500 people have died. And nationally, we continue to see the pandemic surge with nearly 3 million cases and an astounding 130,000 deaths. Leading up to the holiday weekend, we did everything we could to make sure that we all knew the safest way to celebrate, and that was to stay home this year. For those who did go out, we asked collectively that people avoid gatherings whenever possible, wear face coverings, stay 6 feet apart, and wash their hands frequently. Over the weekend, the city handed out over 12,000 face masks to organizations in the Latinx community in recognition of the disproportionate burden of disease affecting the Latinx population. And we are continuing to expand low-barrier testing to communities most affected by COVID-19. And you may have received a phone call or text from the city encouraging you to do your part to keep the community healthy and safe. Unfortunately, there were still dozens of gatherings throughout the city, and many people were not wearing face coverings or masks. But I want to thank everyone who did take precautions. You are literally saving lives and keeping COVID-19 from spreading rapidly in the city. And I especially want to thank everyone who skipped the usual July 4th fun and made sacrifices this weekend. We are in a period, we have been in a period, and we continue to be in a period of uncertainty. And I want to acknowledge that this is a really hard place for all of us to be. And yet, we know what works, and we need to continue to do what works. We flattened, and some would say we crushed the curve once, and we can do it again. If we do not, the consequences could be dire. My commitment to you is that we will continue to follow the science, data, and facts. The results of the July 4th weekend behavior won't be known for at least 2 or 3 weeks, but we must continue to do all we can to flatten that curve again. Don't let your guard down. The virus is still out there, and there's more of it out there than ever before. It is spreading in our community and throughout the Bay Area region. We are working with scientists, researchers, who are seeing that the reproductive rate of the virus is climbing above 1. That means that for each person infected with the virus is infecting more than one person going forward. The virus is increasing in our community. At this rate, it could potentially overwhelm our healthcare system and cause many deaths if we don't get a handle on this right away. I want to make sure that San Franciscans, that you understand how serious and precarious our situation is. Let's look at our health indicators. They are publicly available and posted every day on the San Francisco Data Tracker that you can reach from the City or Department of Public Health website. I encourage everyone to keep up with these indicators and follow along with how the virus is impacting our community. The indicators are scored by color: green, yellow, orange, and red, to make it easier to understand where we stand. Today's indicators show that unfortunately we have reason to be concerned. Our case indicator is red. We are currently diagnosing on average 6.1 cases per 100,000 new cases per day. Our goal is to keep that number to 1.8. So rather than 1.8, we're at 6.1. That is red. That is a serious situation that requires us to pause. Hospitalizations for people diagnosed with COVID-19 have seen a 25% increase over the past week. Our goal is to keep that increase less than 10%. Our hospital capacity, fortunately, remains good. 35% of acute beds are available, and 30% of ICU beds are available for COVID-19 in other patients. But again, that could change at any time, and we know when this virus takes off, it takes off fast. Testing, we continue to expand testing. We're currently conducting an average of 1,762 tests over a 7-day average. Our contact tracing, we continue to follow up with 82%, reaching 82% of cases and 88% of their contacts. And our personal protective equipment, or PPE, is at 89% supply, status yellow. Now let's look at the Bay Area perspective. As we all know, San Francisco is not alone. We are part of an interdependent region where people live, work, go to school, and play across many counties at once. There are cases surging in counties across the region. For instance, Contra Costa has 1,375 cases now in just the past 2 weeks. They have been placed on the state watch list. Similarly, Marin, 1,774 cases in the past 2 weeks. They have been put on the state watch list. Solano, 616 cases in the last 2 weeks alone. They have been put on the state watch list. And we see similar numbers increasing across the region. This pandemic the virus does not know county lines, and we must respect that it is increasing across the Bay Area. So, where does that leave us? Our reopening is still on pause as of June 29th as we work to bring the latest surge of cases under control. We can do it. We've done it before, and it's up to us. I know that this is an unsettling situation, and there are a lot of unknowns. I know and appreciate that businesses are and need to be able to plan, and that residents need to get back to work. While it is so difficult, as the mayor alluded to slow down the reopening that we all want so badly, the price we pay for moving too quickly is extremely high. Remember, this virus has no timeline. Across the country, the virus is surging back in Florida, Arizona, and Texas. In California, and right across the bridge, the Golden Gate Bridge, Marin County is rolling back some of its reopening. And Imperial County to the south is overwhelmed with cases. Hospitals there are full, and patients are being transferred to other counties. In fact, here in San Francisco, we have 13 patients from other counties that we are caring for in our intensive care units. At this moment, we are not dialing back any of the businesses and activities that have already opened, but we are not going to rush it further ahead either. I know that it is confusing to keep track of all these lists and schedules, especially when they may change. Here are some of the public health principles that we are using. You can use them too to guide your decisions. Again, everyone in San Francisco, and indeed in the Bay Area, has a responsibility and an opportunity to protect the community's health. When you think about the risk of exposure and transmission, keep these things in mind. How risky is the activity? First, is the activity indoors or outdoors? Outdoors is much safer. Second, does it involve gatherings with people outside of your immediate household? That is riskier and should be avoided. 3, can you wear face coverings at all times during the activity? 4, can you maintain, and I mean can you really maintain, at least 6 feet of physical distancing? I think some of us have found that harder than we expect in certain situations. Fifth, can you easily wash your hands, and is the environment properly cleaned? Think about any activity in terms of the following 4 characteristics: number, frequency, duration, and distance. Number. The more people who are together, the more interactions take place. This is riskier. Frequency. The more often people interact, the higher the risk of transmission. Duration. The longer the amount of time spent together, the higher risk of virus transmission. Distance. The closer together people are, the higher risk of virus transmission. Keep these principles in mind. Use common sense. Use our common sense. Facial coverings, social distancing. Think about the number, frequency, duration, and distance as you make decisions about how, when, and even if to engage.